diagnosed with cancer is one of the most devastating experiences you could ever ask for. This is because most of us think that it's a death sentence. On today's show, we'll be focusing on ovarian cancer, uterine or womb cancers, and cervical cancer, going through prevention, treatment, and even cure. We'll also meet a woman who has been waiting 4 years to see her daughter walk. My name is Frema Asiedu. This show is proudly brought to you by Vodafone. The future is exciting. Ready?
Oh, Mary, what's the problem?
I think I dropped my purse.
Oh.
And I have to pay an amount of 80 cedis.
As I?
80 cedis.
You know, this is what I would do, huh? I'll go to the bank. I don't know the time and anything, but you know, I'll show you and promise you that, you know, make a banker. My 1 or 2 things we make come boom, you know. I never maybe my son can you know, I'll get you the money.
Oh, I drink it.
What Bobemedi?
Thank you so much.
Oh, man.
What's a nuska?
I'm passion 100 cedis.
That's nice. I know you do feel na madam anati.
Send money to friends and family conveniently via Vodafone Cash anywhere and anytime. Dial *110# or call 110 to send money.
The future is exciting. Ready?
Welcome back. Well, I can't help but say that I miss Dr. Folsom, but we have Dr. Yali here, equally handsome, equally to look at Mythbusters for us today. Doc, how are you today anyway?
I'm doing well.
Wow.
I'm doing well.
Let's see what we got today on our social media regarding Mythbusters. Is this your own fat or I know a bit dear now we are dog. You dear for beneficial.
I'm saying some bisa say near born and near born.
Hey,
say fat are different types.
Silent killer na say.
Your silent one, the loud one. Your boom. In terms of normal because from where I stand, I don't know how any form of fat will be advised. I mean, whether it's the or I mean, I'm not sure, but
Doc, what is it?
Yeah, because when I'm master science, I wonder which of them I'm talking about.
To?
But there's no way where smelling fat will improve your well-being in any way. Not that I'm aware of.
Not that you are aware
Not
of.
that I'm aware
But
of.
is there any medical situation or circumstances where farting in general is beneficial?
Giving, I mean, where I work in my department, for those who we operate on, where we have anything done on the intestines, sometimes the next morning, 2-3 days after, we ask you, Papa, Pacho, service no pay, what's Hana?
What does service count?
Oh, I have a friend come, so we do TV, so they count. They say, what's Hana? And now we down. It's just to tell us that, you know, so the fats and the movement of the bowel, the stool, just tells us that in the gastrointestinal tract is functioning well and is not obstructed in any way, so that things that are inside are able to come out. What is fat? Fat is basically any gas inside the gastrointestinal tract. As I'm talking, I'm ingesting some air. When I'm eating and the food is hot, I'm ingesting some air. So by the time we're done, there's some air that sort of goes into our alimentary tract. Now, even whilst the food is being digested, the process of digestion itself, releases some gases.
Okay.
Now these have to come out.
Okay.
Sometimes they come up through here in a burp.
Okay.
Or down.
That's what kesu.
Thank you very much. Or down in a flatulence.
Down in the
Down there, na it didn't semban because of where it passes. You know, it goes to the entire length of the gastrointestinal tract, passing where your feces are being stored. So I say, channel then it gives us that. So when I ask you in the morning that have you able to pass gas or have you able to move your bowel, it just tells us that the thing has, the tract is working.
Can we say that ETA in general is a sign of a healthy digestive system?
Oh, it tells us that the digestive system, the alimentary tract, is functioning.
And so it's healthy, Anna.
All of us, one way or the other, we do it by the time the day ends. If you don't do that one, you go, you visit the washroom, and then you pass some stool. While you're passing the stool, you realize that invariably it comes with some sounds. Okay. It's all parts of it. So sometimes you don't recognize that in the course of the day, you actually flatulent. Hey. Where this one?
But doc, if you must say, go ha, be also only me yarding. Obu se mo to make us otando. No, I said we are yesterday. I be that yo.
So
baby obefa bia Jane say,
so like I said, so the gas is a product of the digestive process. Now, if you ate foods, you will know that if you ate some foods and then your body does not tolerate them well. We have some people called lactose intolerant. Some people don't digest legumes very well. So you realize that when such people make it a habit to be eating these foods they don't tolerate well, and yeah, they will be farting a lot. So yes, somebody may have a habit of farting. Maybe because of the diet they are used to eating. Thank you very much. So good. If you come from a line where you are lactose intolerant, you don't tolerate dairy milk very well, you have to avoid it.
So dairy milk
good, because we are
beans
patchan. We are di gobe.
Yeah, red.
Deep now say office colleagues no. Oh blast your musa. Sister brother, stop. Weekend no with and they be one way. And now unkwana what them are. Now you're home fine.
Yeah, dear.
So I mean these are some of the lifestyle modifications we can do.
Ne be anyhow. If you no be there, no why you normal way you answer still.
So sometimes there's gas dyspepsia.
Okay.
Sometimes there's gas dyspepsia.
Okay.
Sometimes we give antacids and some probiotics to help. Okay. Sometimes these things to help, but the primary thing is to try and see what is precipitating it, what is bringing it on, and avoiding it.
Okay, but it doesn't improve well-being generally.
No.
Whether would there no be there?
Whether would there no be there? There's no reason why you should make it a habit of either farting in public while other people are there, or looking for fat to inhale to improve your well-being.
Yo, yati. Yo, na buy a story na. Mami bi atwen sa se ne ba ne benante. Kola fefe. Nso ntumi nante na fefo no nyina adwane. Mo bampe ne nyoma nso no de ntumi nante. Yen kwa hwede yakoso.
So there, me ba otoso me nsa. Me wo no 2017. Na me wo no. Onya beye 6 months. Me hu say ne fefo a me ne wo mo wo sa time ni nyina. Obi ejina. Oyese ojina nan ne so a enye yi. Nti me hwe ye na me hu say enan no. Ayese epo bi aba besi so. E me nan no e chia. Nti me yese metu ho na mo de na ko hospital. Nti me de ne ko eye efie nkwanta children's hospital. Me de ne ko hu children's doctor. So my yako performing lab eyibi. Ema yako twitwa ho S3 ene ade. Ti me de brain no ka che me say akra ne nan no ebu. Enan no asan achia. Nti no me fa nko hu bones doctor. Ono na ebe ye nimpa obetumi hu de obede ode be ya akwala no. Ti o kan ye no say kwala ma wo no 6 months de. Eye den na ne nan etumi bu ma ne ye because ne fa no ma akwala bia. Se me mentru na ne aunties ne true no. Ne aunties ne true na ne nana.
Be na me hwe abofra no. Na abofra no apart from or how nam bia no oya afra no ho ye nika. Emfa no ho na ne nan na ye.
Ti me san ekoso e de no kunhu. Eye bones doctor e we fie kwanta wa. Nti ono e no ka kire me say akra no. Oye peche akra no e na nan ne buye. Tina mentiase me ka kire doctor ni say mentiase.
To beto no so ogina wa sore gina bon say nan no wa control na enim han ebu ato yen nan tabon so. Nti ayesa e ma me were ho na me yi meni.
Na doctor nse sadia obey no surgery. Tina to sikasem because surgery je ndafo emundro ye de be koti atani age. Echi na me hu dia menye if you say although my worry but I am a single mother and as I'm a single parent. It's not me hu dia say me. It's na no say me ko hwehwe sika na me de be man because me pese obeye yarefo and I say problem am bia metumi asom ama no na da ache wa be nipa bi no ebe ha no nti no ene de me de me tipempom me nyankofo mo so mi mu yakoye surgery ni ba ya time so ye twa POP no enya be 4 weeks ni ehun say surgery na yakoye ye no akra no enka say ne enhili imom problem na ya west and nine na ekun akitu ebi no echi achiachia nti asan de ko hu doctor o ma ye kutwa ehun S3 o say echi bone no enya infection na say adan na kola ketwa just 2 years they be a problem ontumi nko school because mpemfo no kra no omo hwe no sometimes edin ne papa wo ho de but odiniti adomu a maintain nka tina ma nyomomu aye diama
Oka chem se obeko school na me se onya abotare na se ye ne nan ni wia ye de no beko school
ni nuanom no ekọ school a osu sound on beko omo kwa asori a osu
ne da se me ne twa na me sorry me ja no dem hu ya no se wa sorry do se mama meleba na me ka chem so ontwen na meleba nti na se ade am ye ni me jai na me betena se no di ni tibeto no so mi dia pa nti me pede bia me bompa isire urade se oma ontum nsori nyina ne nan no so urade ni obuafo bi ma ye nga obebua ye
me pese obenanti ni nan no ebe ye no ananti se je ne nanti ya no no so ehu se oka ye hu ebi se sometimes ya ote ho a osu pa ehu se bibi omu ye bibi na ono ontumi ye bia ema na ne hreho ana se obi ti wo na oka ne nan no ho asempe okutantoma na watwe egu nan no so me colleague ba kwa amne no school ese Becky me kun say good afternoon for we hu wo mo wo TV so woman bi wo ya owo obewo we fie kwanta owo wie ne yefunu ye kese pa nti omo no mbe so woman ni mu a omo ye operation ma woman no efa no ho fa ne ba nti aden na won try nhwe na me say okay
ta wo hwe abofra no bra or bre edu bibia ma mere eho sanse me hwe se ne mfrefo erokona na e yare ho nti me hope say Vodafone fo ebosomi nya make ho obeye amai
yo ya ehu se na tie no mse Vodafone fo abemu die nakopon ka mo hu die ebeye Dr. Falson, it's so nice to see you again.
I'm glad
you were really missed.
I'm glad I wasn't here. I can imagine what KK did.
I'll tell you all about it later.
I said nothing. Oh.
All about it later.
Farting is not good. That's all. And I kept
It's
quiet.
not good.
No, smelling it is not.
Now I'll not continue what you are doing.
And then I kept quiet.
Really?
That's what I said.
All right.
Anyway, regarding the situation, me pacho, I have me. E ba ne se na akwala ketwa. Ya wonu pache na ne namu obu.
Inti, like we keep saying, oh, akwala na se oni be fine. Should be very grateful to God, because so many things happen. Uti say, oh, you know who say akwala no na I say a pobi ababesio. Or some say akwala be a handle no. It means that they are giving optimum care to this child.
Yes.
She's being handled by only adults. So it means that the probability to say even nine no will be their dead boy is very low. There are only few instances where mothers would lie about things like this. So you realize that this bone probably had something on it and it broke by itself. Yes, it is possible. It's possible to develop what's known as bone cysts. When you develop bone cysts, once you don't pay no, if you don't pay na, bone marrow no, no. Aha, and only bone marrow no. Good. So, and my favorite, we funny the enemy in 10 feet there go. And the moment experience. So back to the inside, that's the marrow. Oh, I mean, can you seriously no carbon? Anyway, so the bone marrow. Then there's the hard part around.
Okay.
Now sometimes, for whatever reason, no, now either there's a collection of blood or a collection of clear fluid in the bone.
Okay.
Now, majority of the cases, no, they are asymptomatic. I'm interested in their ABS, a colony, diagnosis, and a name, and you say, oh, a colony, not a bone cyst, what we call it, on the bone. But sometimes, no, when they grow and become very big now, then they begin to compromise
the often a system.
Good. I say, balloon and see your womb.
Come on, put aside a pompo, is it don't peso.
And we don't penny more.
Don't penny more.
Don't penny more. Exactly. It's a banisana. When it grows, it compromises the blood supply to the bone and makes the bone weak. It's a banisana who say, akolano, ebia ucha akolane krana na don't penny bu. And you find pathologic fracture.
Hey.
It just say, adia would be you be a enkubuni nino or non called koyana nebu.
So pain.
So most likely no. Possible say something like that now happen to. But you see a Vodafone Abe media. Me sure say there are interventions. Once again, you call back to operating table on this one. There are interventions to take out the cyst. Ye no na yaka don't penny see.
Doc. Mama na when the calcium and say that say ren kase and for calcium munyima ta num sa nyoma na be ma calcium ye nutritionist ya kan mama na bia wanye santi na ne ba ne dompe ne maye mre sa na ase den.
Oh, usually not. Even though I must admit, say it is important that you have a full complement of all the nutrients you need during pregnancy, and calcium is no exception at all. So calcium and magnesium and phosphate and all of those things are very, very important in bone formation, but usually not really the reason why these bone cysts develop. But whatever it is, the marrow, as my Apochinkaka friend here was talking about,
that's me.
just gets collected with fluid, and the bone has a structure that is very strong on the outside and kind of spongy on the inside. So if a certain chunk of your brain lacks the strong part of it now, then the fractures, are very, very common. Especially as you're getting older, na wujina nine or so no. And also the other thing with the underlying pathology is there's a structural problem. If you don't deal with it well, and the fracture occurs, or there's that deficit, now healing is even more difficult. Yes, because the structure and the things you need to cause new bone to form and to be very strong are not there, and there's an underlying pathology that's still persistent. It makes it difficult to heal. It makes it difficult for the bone to Ebenyi na esieni you. Into to me ye cry eche so are associated with deformities which are obvious physically and not the best. So you need a lot of expertise to be able to deal with this.
Is it a collective effort? Okay, say expertise, you need a lot of expertise. Because nyoma effort me bone na waka wan phosphates, calcium, magnesium, bonidine kika ho. Ni nyina wa aduane mu.
From up school, we so na up school pa.
Oh yeah.
Kasa otie pa.
Oh yeah. Yes, school here, yes. Anyway, but sa nyoma wo kan ni nyina e wa aduane mu.
Exactly.
Nti no say ansanka we no say odi sa aduane no no nya more.
So also we no senior can for the pathology no.
The pathology ma kan
pathology any disease. Pathology disease. For the disease no.
Go school but
for the pathology no. Na eating too much calcium no does not necessarily exclude you. So because say ebia oda mosquito net mu every day into malaria. You understand? So it's similar.
It's then a deba.
Oh, yeah, ready. A woman maybe aba.
Oh, and I'm a busium one.
Debbie, we are never busium. It's a sporadic occurrence.
Then it's sporadic occurrence.
Oh,
is it keke?
Oh.
And your genes, so.
And your genes. Is it keke?
And your duane, and your family, and your genes.
Oh, malaria, patch malaria busium.
And tuntu.
To win so.
Anyway. Me gahe na opeso de me to ba sam no hu hia me nti si ana Vodafone aso won be surgery no amano ne ho beto no
most likely cause say ye surgery man no na see to me e correct e nine na I say achi ba nanim na omo ye on be stabilize no be man I straight a pew say the metals be shemu surgeons no mo say no be ye be boa kola based on the age omo yo be man be physiotherapy be to help her any deficits that may have resulted no be boa no so with a collective effort no surgeon physiotherapist psychologist go say nana no ne mama no they are all a little down by a kola no way so as a collective effort the health system would take care of this and make sure that with the help of Vodafone we'll make sure that she would
she'll have a full life,
full recovery. The sky will be the limit and the future will be
exciting. Ready? Indeed, I'm excited to see the results for our beautiful little girl. But coming up, we'll be talking about cervical cancer, uterine cancers or womb cancers, and ovarian cancers. Emma Kokram. I'm going to go baby. We'll be right back. Welcome back. So now we'll be talking about kokram and I say cancers na etato imba wudie mu no cervical ni ovaries ni womb nu ankasa. Now to do that we have Dr. Theodora prepared with us to explain it more. Doc, welcome to Vodafone Healthline.
Thank you so much.
Doc, people would like to know more about yourself. You're the only one. I didn't do that for a good reason. Please, let us know more about you.
Well, quite simply, I was actually born in Ghana, a rich hospital, attended Achimota School, and was fortunate enough to be able to go to the UK to complete my training there, and went all the way up to become a consultant in a London teaching hospital. And I did that for a few years, but then I decided that there was more that I could do, particularly in my area of expertise, which is cervical cancer prevention, to give back to my home country. Yes. So I decided to actually retire from the UK, work part-time. So since 2013, just working part-time there, doing a few clinics, and really come back and give back. And I realized that the greater need, apart from doing a small clinic, would be to get into training doctors and nurses who are key in women's health. I really want to push a big up for our nurses in the Ghana Health Service to help us. And my father always used to say, you are where you are by an accident of birth. You could have been born to anybody. You're fortunate enough to be born into this family. He was a prominent industrialist. So they say that if you're fortunate enough to make it to the top, it's important to send the elevator back down.
Send the elevator back down. Into Nwaba, se obebe chen ase. Mfa ne brofo no nche no. Otichi yo but ne kan nye de papa. Nti enfa nche no. cocram or cancers that plague women, especially in the reproductive areas, no? Can we all bunch it into one thing, say, ni na bako, or the fact that it has different names mean that they present differently, their prevalence is different, treatment is different? Are they all very that different? And that's bomba.
They are quite different. I think the main thing to say is that any abnormal bleeding in a woman or something that doesn't seem right, women, they know their own bodies, they should be listened to and it should be sensitively investigated. Now the womb cancer and the ovarian cancer will normally have some symptoms. Now, ovarian cancer is the one known as a silent killer.
Wow.
The reason is because by the time it presents with its symptoms, it's actually already advanced. So the womb cancers, that normally presents with some bleeding. And if it's acted on early, so patient needs to present early, and if they are listened to and investigated sensitively, often you can detect it and treat that cancer. So womb cancer is one of the more treatable cancers. Now coming to cervical, now I'm going to talk more about the prevention of that, because from 0 to cancer is more than 10 years. So from the majority of time, it's at the pre-cancer stage, and we have a lot of time to detect it and treat it before it ever gets a chance to become a cancer.
So of all the cancers you're talking about, the 3 cancers we're talking about,
Yes.
ovary, let me see if I'm a good student, ovary, womb, and cervical.
That's correct.
Cervical is the most preventable?
That's correct. Absolutely correct. And yet, that is one of our leading cancer killers. So it makes no sense.
It doesn't.
And that's because we're either not screening for it, or when people do get screened, they're not getting the appropriate treatment. And therefore, this is a problem. We are also not vaccinating for it, but that's another issue.
I would love us to focus on cervical cancer because of what you've just said. But in order for us to understand the other cancers, could you briefly just tell us, you said by the time you find out they have ovarian cancer, and that's a chromato ovary or the womb, no, it might be a little bit too late or something. Can you just make that simply for us before we go into the cervical? How would you know you have any of those 2 before we go to cervical?
Right. Okay.
Apart from the bleeding. Yes. Good student.
So I'm going to start with the ovarian cancer. That's the one that's known as the silent killer.
Exactly.
And that's the silent killer because by the time you have the symptoms of that, it's so advanced that most treatments will not work.
So how would you prevent that? How would
I'm
worried.
It's a difficult one because there isn't any proven screening tests for it. In order to test, for a screening test to be good, the condition has to be detectable at the pre-cancer level or very early cancer level. And we don't have that with ovarian. So some of the symptoms that people get with ovarian is they may get bloating, whereby, I'm not just talking about just normal putting on weight, because that happens to all of us, but you find that maybe around the waist this suddenly starts getting bigger. And then, but the rest of you may also be losing weight, but around the waist, you get bigger.
Kwashiorkor-looking adult.
That's correct. That's a very good description. And also a feeling of fullness, because what happens is a lot of fluid develops within the abdomen, which makes you feel full because it's pressing on the stomach, or they have difficulty breathing. So sometimes people may be asking you, are you pregnant? When it's come over a short period of time. So these are some of the symptoms that you may get for ovarian.
Dr. My main kano kakra wo fast. Dr. Press ovarian no in pain no ye hu symptoms hu symptoms na ya ka echi. To bia ba hu say body na nkasa o fon o so te nso na wafu ai docho say e kwashoko no hu afa esu no esan say nsuo bagina afu ni mu na e press brofo na saba e press o lungs into hu me crown to me hu me papa obo an obi bisa say de wafa yefu ana afa wafa yefu ana ha te na meti ase mayade
why ade pa
good. Okay.
So it's a good idea that if you have these symptoms to get checked. If people can afford to have maybe a pelvic ultrasound, maybe once every 2 years even, sometimes that can pick it up, but it's not a confirmed way of screening. That is what is there. So I'm not going to talk about the womb one.
So much. Okay, well, the womb one, you've mentioned the bleeding, no?
Yes.
So an abnormal bleeding, we should make sure we go to the hospital to get it checked.
Exactly. Okay. Especially post-menopausal bleeding. That's very, very important because that's where it's commonest.
When we menopause. And no asa boom sabi. Okay. Yes.
So if you've gone through the menopause and 6 months later you start bleeding again, it's not because you're becoming a young woman again. You have to be investigated.
Doctor,
please go and see your doctor.
When we menopause, 6 months later. Usa chima bi mo doctor. Okay. Now the cervical no so.
Cervical, you can't detect it even looking at the cervix, you can't tell that it's there unless you do what's called a pap smear. Or we also have something called VIA, which is visual inspection with acetic acid. And a number of places are now doing that, where they will look inside the vagina and put some vinegar on, and that can help to detect these pre-cancer changes. I'm emphasizing the pre-cancer because you'll detect changes before it even gets a chance to become cancer. And there's at least a 10-year window for that right now we are missing those opportunities.
10 years when you're cancer no from day one could see about 10 years answer than cancer ankasa. The full 10 years cervical cancer you can prevent, you can treat it at that time before it becomes full-blown cancer.
Exactly. Hey. Before it even becomes an early cancer, never mind full-blown. Yes, we can detect it.
What are the what are those preventable things that we can do? What can pap smear and VIA be? Apart from those, you need
no, because you will not have symptoms. So sometimes people will say, oh, I know my body. No, by the time your body starts talking to you with abnormal discharge or bleeding, that means that we are already looking for a cancer. If we're looking at the pre-cancer, in those stages, there are no symptoms whatsoever. It can only be picked up by this test of the visual inspection with acetic acid, which they can do in a lot of facilities now in Ghana, and together with Dr. Fambato Hospital, who is training a lot of nurses at this as a cervical cancer training center there, to be able to go across the country. So we've trained people, as have I, all the way Bolgatanga to Cape Coast and everywhere, so that women have somewhere to go to at least be able to access it. Because there's no point saying this is what you should do if there's nowhere to access the training, or to access the tests. So there are different tests for different pockets, and certainly VIA or visual inspection with the acetic is actually the cheapest one, and we're hoping the government will get involved in helping to sponsor that as part of the National Health Insurance.
Well, let's hope so too. But regarding treatment, now they've done it, there's something a little bit there. Treatment, is it expensive or is it simple? Can I just walk out? Is it dangerous? Can it kill me or they take away my whole womb?
No, that's the important thing, is that, remember, we're dealing with pre-cancer, not cancer. So this is why if we detect it early, we can actually do simple treatments. Sometimes it's just a small freezing treatment, or to burn the cells away. And these treatments have got minimal side effects. If it's left untreated and becomes a cancer, that's when you're looking at needing a hysterectomy. Now, I need to mention that when it's at the pre-cancer level, unless there's some other reason for a hysterectomy to be done, we really should not, and I stress not, be doing hysterectomies on women, especially of childbearing age, unless there's another reason that they need to do it, whether it's fibroids or some other reason. But for the pre-cancer abnormality alone, I stress that a hysterectomy is not one of the treatments. So women shouldn't feel scared to go and have a pap smear. I feel sometimes they feel if it's abnormal, somebody may take their womb out, and that's not the case.
Taking the womb out, now say hysterectomy.
Hysterectomy. So that is not. So the treatment is actually just a simple thing on the neck of the womb. They either just put some freezing treatment there, and it's done within 10 minutes, and you go home.
Within 10 minutes,
absolutely.
Yes. So there's nothing to be afraid of.
Not
and it will save your life.
It could definitely save your life.
You can have babies afterwards?
Exactly.
Without you having to go and stitch your womb or anything.
Exactly.
The neck.
Yes.
Be okay.
Be okay.
When I say you,
Gabi.
Ma. I am able to say prevention is so much say country bit is Australia. Master say one panie bi. Vaccination bi ni nyoma me say vaccination be na cervical cancer so it me vaccinate nipa.
Yes, for the last almost 20 years, there's been a vaccine available to prevent cervical cancer, and it's best given to school children before they are ever sexually active. Before, so the best age to give it is certainly in the UK they're giving it from the age of 12, because also when you have the school children, you can gather them all and do vaccination, because vaccinations work best when the majority of the population is vaccinated, and this is an example of one of the vaccines that's available.
The side effects?
Yeah, there really are, apart from the usual side effects of a sore arm, or some people feel a bit of fever, you know, we have tetanus and typhoid and all these. But these vaccines can save lives. And I would stress that if people have daughters, the daughters, if you can afford it at the moment, again, the government says it's in their program, but it's some way down because we have other childhood vaccines to deal with. But if you can, these are very good to do. And again, ideally, we would like to vaccinate even the boys, because when you have what we call herd immunity, it works best. If we can afford to vaccinate, we can eradicate a condition. So it's very important. And they're already seeing the benefits of vaccination in countries that have done this, where now those people are, they vaccinated at 12. Now they're coming for the screening, where in overseas they start at the age of 25. They're realizing that the levels of abnormal pre-cancer has drastically dropped.
Wow.
So they're even saying that we Guyanese who do that, we should start looking for another job, because the vaccine is working so well. But at the end of the day, we are where we are in Ghana. We have a lot of people who already have the pre-cancer cells. So let's work on that, while some years later the vaccine will come to us. But we shouldn't just sit down and say we're doing nothing because we don't have the vaccine. There's still a lot we can do to prevent.
We can't talk about prevention without talking about the edema. So we can see how we can stop what brings, at least if we can do something about contracting it or getting it in the first place, perhaps it's a step to prevention.
There isn't really much, and I want to try and remove the stigma that sometimes comes around this, because the pre-cancer abnormalities, which over some years, if not monitored or treated, can become cancer, caused by something called human papillomavirus. I don't want to be too scientific. HPV. But this is extremely common. It causes like facial warts in children, the warts you get on the hand, verrucas, and also it can cause genital warts. But those are not the kind of HPVs we're interested in. The ones we're interested in are what we call high-risk types, which is what some pap smears can detect. That we can do. And those ones, you don't see anything at all when you look at the cervix. You don't see anything. Sometimes patients say, you know, but when the nurse did my pap smear, didn't she see the abnormality? I said, because when it comes out, I said, no, you won't see anything, which is why it's very important to have the test done, or when you have the VIA, when we put the vinegar on, acetic acid is the medical term for vinegar, same like salad vinegar. It's not anything worrying.
Strange.
Yeah. When you put the vinegar on, then the abnormal cells show up. But without that vinegar, you look at the cervix, it just looks smooth. So, so therefore, I don't want us to use the HPV. Yes, it is spread through sexual contact, but it's not a sexually transmitted infection in that regard. So we counsel women that just because you have an abnormal pap doesn't mean you go and hold your husband, or where have you been? It doesn't work like that. And it's very important to counsel patients, because otherwise this thing can, you know, destroy relationships if the correct counseling isn't explained. And what we'll say is that even somebody who's only ever been sexually active once needs to be going for pap smears, because it you know, the virus can start through there. But most of the population, 80 to 90% of the sexually active population, have had this HPV at some time or another. I'm sure I've had it at some point. You have had it. It's very common, and often the body can clear it on its own, unless you have people maybe who have HIV or have had transplants where the immune system is depressed. They may struggle more and need extra surveillance. But usually the body can clear it, but sometimes it can't, and those are the people that we want to watch. And so it's in everybody. Men also have it, but they are clearing it, and luckily for them, the virus doesn't like the penis, but it likes the cervix, and that's why we have a cervical screening program. We don't have a penile screening program, but it's everywhere.
Well, Matthew Yasempa, Dr. Theodora Pepra, actually, and your bebre. Or say, Moban Tamwa, and you who cry, 10 minutes, pets a bill on quan dear, 10 minutes, permit me be for now, chairman I need to do more. And I'll be banana after a ginsem. And then there are ginsem or cry, not any treatment in there, and not form. But the episode seems to cheer upon and say, Mumayan town courts are screening maybe. Perhaps me and Nanka, be the only book crowd from crab, acetic acid, 7 egadiano. Mumayan Quanian Titu Mama. Money mema I share that. Why? And why am Thank you so much. Thank you so much for joining me on Vodafone Healthline.
You're welcome.
We've learned so much. Thank you very much.
You're welcome.
Well, we'll be right back. Don't go anywhere. There's more to learn. Yeshia Bekino. Now she's been waiting for her daughter Basilda to take her first steps. Now let's join them at Efia Kwanta Hospital while Basilda is being prepared for her surgery.
Basilda was seen here in 2017 with a pathological fracture. That is, there was no really injury or trauma to the bone. She was just there and then the bone got broken. The bone here, we are talking about the tibia bone, which is in the leg. So we did some investigations and we realized that she had a bone cyst, and probably that weakened the bone. Indeed, that weakened the bone and made the bone got broken. So we decided to do an operation to remove that cyst. When we went in, we realized the right tibia, that's the bigger bone in the leg, was broken as we saw on the x-ray, and it was not healing. And also the fibula, that's the smaller bone in the leg, was also broken. We realized that where the bone was supposed to heal, the fragments have overlapped and covered with some fibrous tissue. And that was what was making it, the bone not healing. So what we did was to remove those tissues that were covering the fracture sites. And then we nibbled the bone until we got raw bone which was bleeding. And then we opposed them together. And then we washed the wound and then we closed the wound. What we did was, we didn't want to put in any metals or anything, so we put POP to fix the reduced fractures, and we molded it the way we wanted it. So in effect, at the end of the day, when the bone heals, we're going to get the deformity of the leg corrected, and hopefully she should be able to walk and go to school and do whatever she's supposed to do at her age. So generally, the surgery was very successful.
It's amazing. Blessida is doing so well.
Yes.
She's doing so well. And you
great.
missed.
I did.
You missed a lot.
You see, before we even talked about this, I knew what he was going to do. I'm surprised he didn't sing Marata or something like that.
So you see, I think you were controlling my mind because I ended up...
No. Anyway, the show is drawing to a close. As you can see, we are excited. We are having fun because Blessida is doing so well, and we are grateful to Vodafone for all the good work that they are doing.
Yeah.
Let's keep the conversation going on our social media handles. And remember, this show was proudly brought to you by Vodafone. The future is exciting. Ready? It wasn't me. It wasn't me.
It was him.
The future is exciting. Ready?